Hello, we would like to introduce our panel today. So Denise, would you like to start it off?
Sure. I'm Denise Gipple. I am Director of Population Health and Quality, and I deal with infection control here at Mahaska Health.
I'm Sean Richmond. I'm a family physician that does obstetrics as well.
Kevin Durandi, CEO of Mahaska Health.
Jamie Robinson, Mahaska EMA 911 Administrator.
Patty Malloy, Mahaska Public Health.
I'm Jan Levine with Southern Iowa Mental Health. We're housed here in the hospital.
Thank you. Mahaska Health patients and community. Your care and safety are our primary concern. We are closely monitoring CDC, local, and other government agencies in real time to stay up to date with the latest information and guidelines. At Mahaska Health, we remain committed to the continued safety of our patients, employees, and community members. Our leadership is staying in regular communication with local, state, and national public health officials as we work together to prioritize the care and safety of our patients, their families, and the Mahaska Health team. We are taking extra precautions to provide the safest environment possible and are following precautionary and proactive measures provided by the CDC and state departments and the Iowa Department of Public Health. Some of the changes to our normal practice procedures include visitor restrictions are in place at all Mahaska Health locations. This includes the New Sharon Medical Center and Serenity House. As part of our comprehensive and proactive approach and per the recent guidance by the CDC, effective March 16, prior to entry and registration, all visitors to the Mahaska Health campus must pass a brief health screening, temperature check, and travel history. We have recently updated our visitor guidelines and are in place at all of our locations. In addition, we are taking proactive and precautionary measures recommended by the CDC, and effective tomorrow, March 19, Mahaska Health entrances doors 2, 3, and 5 will be closed. Doors 1 and 4 will remain open. Doors 1 and 4 will have tents set up, and all patients and visitors will be screened and have their temperature taken utilizing a sticker system. This is a precautionary measure and will serve as an extension of our registration team to help keep everyone safe. Remember to take steps to keep yourself healthy. Wash your hands, avoid touching your face, and practice appropriate self-care, including staying home when you are sick. Regularly sanitize and clean surfaces around your home and workplace. If you are experiencing symptoms that include fever, cough, and difficulty breathing, and believe you had contact with a person with COVID or have traveled to an impacted COVID country in the last month, please do not go to a healthcare facility. A public hotline has been established for Iowans with questions about COVID. This line is available 24/7 by calling 211 or 1-800-244-7431. Proper screening and assessment will occur over the phone, and you'll then be advised on next steps. These precautions are important, and they help ensure your safety and protect others from possible exposure. We appreciate your patience, as some of these measures will be a bit inconvenient. It is our goal to provide you with the best possible care. Please visit our website at mahaskahealth.org or cdc.gov for current and accurate information, along with tracking our Facebook page regarding any updates. Partner with us to stay safe, healthy, and informed. And with that, we do have some questions that have come up, and we would like to address those questions. And so, Denise and Dr. Richmond, thank you for being here today.
Yes, absolutely.
So one of the very first questions, and kind of a more specific question that we received, was in regards to pregnant women who feel that they may be infected with the virus. Are there any risks to unborn babies with COVID-19?
Yeah. Regarding pregnant women, we do not know if a woman is pregnant and contracted COVID-19. As far as we know, there is no risk to the unborn baby. Okay, so we can feel good about that. Now, if the mother were to happen to get this viral illness and then go into labor while she is sick, Then we would take precautionary measures to try to protect the baby, and obviously this would be in discussion with the parents, but there is some data to say that perhaps we would lean towards maybe separating mom and baby, providing some distance, masks, things of that nature. So we would certainly take some precautions there. But as far as it being a risk to the unborn baby, no, there's no risk there.
Thank you, Dr. Richard. To the folks on our leadership team, can you speak a little bit to how Mahaska Health is protecting their employees?
Absolutely, I can take that one. We have spent some time looking at who needs to be here on campus to do their job and who could work remotely. I think this is common among all businesses, but we have special challenges here because we need staff here to take care of our patients. So we're looking at sending home some of our employees to work from home. We've looked at our essential services and what is not essential at this time, so we can reassign some of our staff to work in those areas where they're most needed. And as you heard Kevin talk about, we're looking at symptoms every day. So we want to make sure that someone's not coming to work while they're sick, because then they could infect several other caregivers, and we need to keep everyone healthy.
And we are also screening all of our employees each day.
Can you talk about some of the plans that are being put into place? Kevin, you spoke to it a little bit. I know some folks maybe had seen some tents outside of our facility the other day. Can you touch again just on that, what that process will look like for patients and visitors?
Yes, in hospitals, we plan for emergency preparedness, and so we run drills. And so, as I stated just a little bit ago, we will be implementing those tents at doors 1 and door 4. So.
Let's see. The public wants to know what is the emergency plan? Is that something that they would have access to? Denise, I know you kind of talked about this.
We do have a task force that is meeting on a daily basis, 7 days a week. And so we have a task force plan in place. And so depending on what happens and things that come up, then different sections of those plans we do implement and mobilize. And we're thankful for Jamie as a partner, emergency management, and so we appreciate his help as well.
So there were a lot of questions received about testing. So people want to know who gets tested. How do you decide who gets tested? What is the value of that test, and maybe even to speak a little bit about the validity of that test as far as time goes, and what people are doing after they've been tested.
So first off, we are utilizing tests, and we're using the State Hygienic Laboratory, which is our public health laboratory in Iowa. And everything submitted needs to meet the criteria that have been set out by the CDC and the Iowa Department of Public Health. So to be tested, someone needs to have symptoms of respiratory illness with fever or respiratory symptoms. And then they also have to meet one other criteria. So that would include the exposure history to a confirmed case. So just to be clear, it has to be someone who's been confirmed. So it can't be just that they heard someone may have had it. It needs to be a confirmed case. And then the travel history is to those countries that the CDC has a level 3 travel advisory for. So those are international travel. That is not yet including any of the states around, any of the states here. It's not Washington State or any specific states. And then the other criteria for travel would be international cruises. And the timeline for that travel is within 14 days of being sick. So if you traveled internationally or were on an international cruise, then 14 days, then you could be tested. So we have to meet those criteria, otherwise the State Hygienic Lab will not perform the test. If you think you meet the testing criteria and you need emergency attention, we always want you to come to our ED, but let us know if you think you may have COVID-19. The big key is communication, so let us know ahead of time. If you think you have COVID-19 and you don't need immediate attention but need to be seen, just call ahead so that we can plan for your visit and we can meet you with a mask and identify where we will see you. Again, we're activating that emergency plan,
Correct.
trying to keep people well and all of those things. So the test is for screening. It will tell us if you have the disease. It does not mean that we will treat you any differently because the symptoms are treated with supportive care. So.
The next question would be for our public health coordinator, Patty. What is being done, or what can the public do to mitigate the spread of this virus and be proactive in that?
We've done a lot of plans with the closings of schools and restaurants and that kind of thing, and the reason for that is that we're doing social distancing. We're not gathering in groups, keeping groups, smaller than the size of 10, and just kind of staying in our own little isolated, family units, that type of thing. So, yeah, just, washing your hands, covering your cough, staying home when you're sick. That's the big thing. If you feel sick anytime, to prevent this and other symptoms of anything we want to not share, stay home.
Absolutely. Thank you, Patty. And so the next question would be for Jan, who is represented from Southern Iowa Mental Health, just to provide an update, I suppose, on the behavioral health perspective during the COVID outbreak.
Sure. At this time, we're following all the protocols that MHP has outlined as far as screening staff and screening patients. We're encouraging patients to stay home if they have any symptoms or if they're feeling ill. So staff are available to visit with them on the phone if they need to versus a face-to-face visit. If they need medication refills, we're attempting to honor those the best that we can as long as they are an active patient of ours. At this point, we are fully staffed and open, looking at options though to be able to provide remote services for people that they could stay in their home and still have access to their therapist or their medication provider. None of those have been secured at this point, nor have we necessarily moved forward. So our plan is to have our staff available in the office today and the rest of the week. We also continue to have our emergency services available 24 hours a day. People can call for assistance to the main office here in Oskaloosa or the Ottumwa office after hours and weekends. Our crisis stabilization unit remains open, and they also are screening in the same way that the hospital is to assure safety for staff and for individuals that might need to be served. At this point, our mobile crisis team continues to be available, again, asking some screening questions before they would consider going out into the community just to make sure that they're not putting themselves at risk as well.
Thank you, Jan. Jamie Robinson, would you like to give any update at this time from emergency management?
Sure. It's kind of there's a lot.
Can you talk about maybe some of the different partners that you're continuing to work with? and
Well,
some of
of course, our main ones are sitting right up here. So we've got the hospital and public health. Those are the two main partners, making sure that they have what they need as this kind of rolls across the state or across the country. I guess from my perspective, the main thing for people is just to remain calm. I know yesterday, because we set up some tents, of course, Facebook blows up immediately and says, "Oh my goodness, what's going on?" We're doing a lot of things that we've trained on in the past, that we've talked about in the past, and we're putting them into play so that when this happens, we're ready. We don't want to get stuck in a place that isn't familiar to us. So we talk about things. We look at the worst case scenario. I strongly encourage people the social distancing. We talked about it in a meeting this morning. We canceled schools. Businesses are slowing down. If we're doing all this, let's do it for a purpose and keep away from each other. Because if you congregate in large groups at the mall or different places in the community and cause the virus to spread, then canceling and doing all this was for nothing. So there's going to be the question when this is over, did we overreact? Did closing all the schools, was it worth it? Well, if we don't have much of a spread, to me it was worth it. And hopefully that's what we're going to see. If no spread would be great, but I can't think that. Not my job. We're working with businesses, cities, any information that we get, we're making sure we're passing it on. We've got resources we've requested from Iowa Homeland Security. We've just started this, and we're already working with the federal side of things to make sure that the hospital, my office, and whoever else gets assistance, looked at getting reimbursed for the money. I know the hospital's really putting some money into this to make sure that they're ready and prepared. Even the staffing and overtime expenses that they're looking at right now. So we want to make sure that we're getting optimal reimbursement from the federal side on this. And that's stuff we're looking at right now, even though we're just getting started. So we have a lot of stuff going on. Follow the hospital Facebook page, emergency management. Go to our websites. We're updating it daily. If you see something on Facebook about a store closing for 4 weeks, go to the hospital page, go to the emergency management page, and if you don't see it there, send us a message, call us. But don't just start sharing information that you cannot confirm.
I think it's important to remember the reason we're doing all this is to slow the spread. I mean, we know it's in the United States, we know it's in Iowa, but our ultimate goal for public health, and we're getting our information from this CDC, from the federal government, they're looking at what's happening around the world. So this, is a lot of, that's where we're getting our recommendations from. So we're following those recommendations so we don't surge our medical system to the point where we have to make decisions that are harder than these decisions we're making now. So I just want people to, remember that, because that's really important. We're just trying to prevent, just being a surge on our system because right now, if we need help, we reach out to outlying communities and other hospitals. Currently, those hospitals are being surged. We might all be being surged at the same time. So flattening the curve of the spread and slowing it down until more things are developed, like a vaccine, is just the ultimate goal. So that's why we're here.
So I'm thankful for this team and the partnerships that we do have. We want to recognize police, fire, sheriffs, and deputies. We're thankful for this care team that is really coming together to make sure that we address anything that comes down the pike. So thank you.